What's up? What's up, everybody? So I'm going to be going live today with my team from Whitman-Walker Health. What's up, Torian? What's up, Cass? I miss you. I haven't seen you in a long time. So today we're going to be talking about the new masking policies that or masking guidance, I should say, that the CDC released last week. I'll be bringing someone on from our Whitman-Walker team to discuss some of that guidance and also give some recommendations about moving forward with that guidance. So my name is David. If you do not know, I've been working with Whitman-Walker Health for over a year now. It feels like, wow, it's really been a while. And I get on here and I cover several topics about sexual health, public health interventions, et cetera, et cetera, et cetera. Our pronouns are he, him, his. But again, we're here today to talk about the new guidance that was issued about wearing masks. So the new guidance comes out nearly after half of Americans have received at least one dose of their initial vaccination. Since then, cases, hospitalization, and deaths have decreased dramatically. The new guidance actually covers both indoor and outdoor activities, but most of the changes actually cover those who have been fully vaccinated in an outdoor setting. So I want to make some distinctions today about what unvaccinated people and what fully vaccinated people can actually participate in based on those CDC guidance. Today we're going to be taking a look at the guidance again. Marshun, he's from Whitman-Walker's community health team, and he's going to get on to discuss that with us. First, I want to get a image of the new guidelines up for you all. 1 second. All right. So as you all can see, this is a graphic that illustrates the new guidance from the CDC. Basically, that new guidance identifies what unvaccinated people are able to participate in from a no mask policy guidance on the left-hand side, and then what fully vaccinated people should consider as far as mask guidance on the right-hand side. And so if you see on the left-hand side, for fully vaccinated, unvaccinated people and fully vaccinated people, it's recommended by the CDC that you do not have to wear your mask outdoors if you are running, walking, biking, or doing some outdoor activity with people who actually live in your household. And this is for unvaccinated people as well as fully vaccinated people. Also, if you're attending a small outdoor gathering with fully vaccinated family or friends, there's not a requirement to wear a mask, right? For our unvaccinated people, at this time, if you're still attending an outdoor gathering and it does include unvaccinated people, then the recommendation is that you still wear your mask. For fully vaccinated people, you don't have to wear your mask in those cases. And then for dining at restaurants, I know a lot of us have been going out. I've been going out even more since I'm now fully vaccinated, to outdoor restaurants and even some bars that have outdoor seating. If you are, at those events or at those restaurants with multiple households, then it's still encouraged that you wear your mask if you're not fully vaccinated. If you are fully vaccinated, then you should be fine to go ahead and remove that mask. And this is guidance if you're participating in some like outdoor eating or at a restaurant drinking with folks from multiple households. And then if you're attending a crowd event, let's say it's a festival, a circuit party, or any other crowded event, then whether you are fully vaccinated or unvaccinated, then it is still important that you wear a mask regardless. And this is for attended crowded outdoor events like a performance, a parade. The guidance is still that fully vaccinated or unvaccinated, you are still asked to put on your mask. Um, and all this guidance is for outdoor activities. I'm going to show another graphic that indicates what the standard is for indoor. I feel like I'm doing a PowerPoint presentation. All right. So for indoor activities for fully vaccinated or unvaccinated people, you're still required to wear a mask. For indoor people to go to an indoor movie theater, full capacity worship, church, whatever it is that you actually do to worship, mask up, sing in a choir, eat indoor restaurant, participate in indoor high density exercises, those all still require masks. So that guidance has not changed. It is still the same whether you are fully vaccinated or not. Gonna go to another graphic. I think it's this one. Yes. Now, these are the less safe activities, which means that the ones I just described were like more than less safe. But if you're going to a barber or a salon or to a shopping center, to ride public transportation, or to attend a small indoor gathering with unvaccinated households, then you still have to wear that mask whether you're fully vaccinated or unvaccinated if it is indoors. So to kind of abbreviate this entire conversation, the CDC provided new guidance for outdoor activities. Everything for indoor activities, the recommendation is still to wear a mask if that is occurring indoors. For outdoors, there are some new changes for fully vaccinated people. And again, those are if you're biking or running or working out with people from your household, then you don't have to wear a mask if you're fully vaccinated. If you're hanging out with fully vaccinated friends, then you don't have to wear your mask if you're fully vaccinated. And if you are attending a small outdoor gathering with fully vaccinated and unvaccinated people, but you are fully vaccinated, you don't have to wear your mask. If you're dining at an outdoor restaurant as a fully vaccinated person, you do not have to wear your mask. So I hope people enjoyed that guidance. I am going to bring on my partner, Marshun, to him about how he feels about the new guidance. What's up?
Hi Dave, how are
How are you?
you? I'm good.
You want to
Um,
introduce yourself?
yes, of course. Hi everyone, my name is Marsha Redmond, pronouns he and she, and I'm the community outreach specialist here at Whitman-Walker Health. And Dave, I love the way you just went through the chart and just kind of like broke it down in simpler terms for everyone. Just because looking at that chart, I was like, what does this mean? I didn't even realize they were wearing masks on one side and masks on the other side at first. So I was like, yeah, I'm really happy that they made this for people, just as like a reference guide.
Yeah.
Um,
So so that's your first impression, right? Like you was like, oh, I didn't even notice that they had changed the graphic on one side had like mask and the other side. Like, what is your feelings about this new recommendation? Like, are you fully vaccinated, Marshawn?
I am a
And
Team
so
Moderna.
how does that
Team
make you feel?
Moderna. Well, honestly, when I first read it, my first impressions were just like, I'm still gonna wear my mask. I'll probably wear a mask until I die, even in my casket, have a mask on me. Just because I know that we've received the vaccine, but we still want to be safe ultimately at the end of the day. So my first impressions were definitely, I'm sure outside is definitely gonna pick up now. Traffic's gonna increase, because we don't have to wear masks. But I'm also happy that they created that because I know a lot of people are definitely anti-mask. So it'll at least give them some leeway to kind of, decide to wear their mask in different spaces, indoor or outdoors.
Yeah, I'm also fully vaccinated, and I do. I feel like it's have become like an out of respect thing. Like, even though
Right.
I'm fully vaccinated, people don't know that by looking at me. And so, like, in order for me to just make others feel comfortable, I still wear my mask unless I've had a conversation with them about being fully vaccinated.
Right.
It's like, let me share my fully vaccinated status with you before you
Let me
remove
show
the
you my
protection.
card.
So I still wear my mask just because I think, it makes people feel comfortable not knowing if I'm fully vaccinated or not. But when I'm around my friends and they know,
Right.
I definitely feel more comfortable that the CDC dropped these recommendations that I don't have to wear a mask as a fully vaccinated person. So how do you think like this vaccine, or I mean, excuse me, this announcement about the mask affect the view of the vaccine? Do you think that helped it? What do you think?
I think it helped it because it kind of gives you even more reason to believe in science. Because I know people were all, had this vaccine become created in such a short amount of time, blah, blah, blah. When I don't know, I just kind of look at it as something for us to be happy about rather than kind of like trying to question. Because this is something that's killed many of our loved ones. And if you do have the opportunity to get vaccinated, of course, we highly recommend it just because, like you said, out of respect for other people, we're going to still, wear our mask. But I'm really happy that they released this information because people are wanting to go outside more. It's summertime. As you know, Dave, it's warming up outside, so we want to be outside. So what were your thoughts on the announcement?
Um, to be honest, I was happy like as a fully vaccinated person, but I guess I get a little weary about like because it is a more relaxed guidelines, right? And there's no
Right.
real way to tell if a person has been fully vaccinated or not. And so personally, I was like, well, I hope this encourages people to get the vaccine so that they, don't have to wear a mask in certain outdoor spaces. However, another half of me was like, well, like anybody can say they got the vaccine or whatever, and how would I
Right.
know? And so that was my concern. But I'm gonna assume that
Hmm.
all people are good and that they're gonna be honest about this, and I'm just gonna throw that off to the back burner, right? But that was
Right.
my
But
immediate concern. But I'm hoping that it motivates people to actually get the vaccine now that it does relax. Also, it makes me happy to know that if my family, if all of us get the vaccine, we good. We
right.
good. We can hug and we can be around each other and a lot of things that we haven't been able to do in a very long time. So that makes me feel good, knowing that
Right.
if I can convince my family members to get this vaccine, then we can have our family celebrations and things like we used to have.
Right. And also for individuals who aren't vaccinated, they can still participate in
Hmm.
various outdoor activities. It doesn't necessarily have to be an indoor thing. So I think it's great that they
Yeah,
made a distinction between the two.
for sure. What other tips do you got for like our community? Like, what do you have for us? You're an expert in community health. You've been with Whitman-Walker now. What tips
Yeah.
can you provide us?
So I would just remind all of our viewers that DC does have walk-up sites for vaccinations. Um, Hopefully soon, Whitman-Walker, we're able to offer walk-up vaccinations. Fingers crossed. And for my people living in Virginia, you can still register to the portal. And then for Maryland, they have walk-up test sites, and you can still register in the portal for your vaccine. I know
Hmm.
it can be a little bit frustrating, but just try your best, you guys, and be patient. The time will come, I promise you. And I also feel like I want to encourage folks to have risk reduction conversations with your people. As you said, your entire family getting vaccinated, that's a conversation you guys had. So, of course, we want people to have those conversations if you're sharing your space with them. And that includes like quarantine pods or vaccination pods,
Yeah.
whatever they may look like for you and your circle. Um, and once again, of course, we also want to have COVID preventative tools and efforts
Hmm.
before meeting up with your friends. So,
Hmm.
create like a plan, ask your friends if they're feeling well, because we know sometimes we just want to go outside knowing we may have a little cold or something, but we
Hmm.
want to be safe in these times because we don't want to discomfort anyone or upset anyone for not being COVID safe. Um, Also establishing safety measures for you and your friends and creating, comfortable talking points for your friends. which also goes back to a plan. Um, and I guess my last step would be continue to get tested for COVID when
Yeah.
appropriate. Just because we do know that the vaccine is going around and people aren't um, people aren't getting vaccinated. Although we still recommend you getting tested for COVID, just because you never know. We always want you to be safe. We don't want you feeling well,
Yes.
especially going around people.
Yeah, it's actually good. That's a good point. So as of right now, fully vaccinated people are still, required to get tested if they're going to participate in certain activities. Like, I know like there are certain people who are fully vaccinated, but they're going back into the office at work, right? Their jobs are still making
Right.
them get, not vaccinated, making them, get that COVID test just to verify that even though they're fully vaccinated, we're still learning a lot about these vaccines. And so getting
Hmm.
that COVID test still helps us keep track of this stuff and make sure, like, one, the vaccines are effective, right? And two,
Right.
that, if a new strain comes out and we are not aware of it, that we're still taking that secondary precaution. So I'm still doing that.
Absolutely.
I actually got me a COVID test yesterday.
Okay.
And so, I definitely encourage people to do that. And I also want to mention something else that could be it's a whole separate topic, Marshun. And what I'm starting to experience and see is a lot of COVID shaming, which I do not encourage at all.
Yes.
I think that we should, like, if people decide not to get a vaccine, let that, be whatever. We don't know what their beliefs are. We don't know, right? I definitely encourage people to consider getting the vaccine, but let's not shame folks if they decide not to. If you are able to get the vaccine and it doesn't impede on who you are or what your beliefs are, then hey, go for it. But let's not COVID shame. And yeah, that's all I had. That's my little tip.
Yeah, and also with that, because like you said, that is a totally different conversation. But what I've learned is when I do come across those individuals, actually having a conversation with them and explaining the different vaccine trials is very helpful because people have a lot of myths and they've heard different things from their friends they've seen on the internet. And with us being, I'm going to say we're pros now when it comes to this. We definitely have to share the knowledge that we have. And my last most important tip was always wear a mask. I should have started off with that one, but be sure to wear a mask and wash your hands for at least 20 seconds.
Yes, yes. And I was actually going to go into that as well. But yeah, wear a mask. I even know there are some people who have been, sustaining from sex because of COVID-19. And there have been some who decided to maybe have, some masturbation sessions. I totally support that. But they've incorporated masks and other barriers into those practices so they can still get that sexual pleasure. But make sure you're washing your hands, make sure you're washing your bodies, and all of the toys that you are using
Yes,
during that session as well. Do what you got to do, but just be safe about it. That's all that I ask.
always.
Anything else that you have for us, Barshad?
No, everyone, if you're interested in free HIV, excuse me, free HIV and STI testing, you can call us. We can slap you on the schedule at our Southeast location or our Northwest location. And also, if you're needing COVID testing, we are offering COVID testing in the pinned comment at the bottom, the 7,000 number. So,
Absolutely.
yeah, that's pretty much it for me.
All right. Well, thank you for joining us again today, Marshawn, and I will see you next time.
Okie dokie. Bye. Bye,
Bye.
everyone.
See you later. All right, you all. That was Marshun Redman. He's a part of our community health team. Let's thank him for joining. I do want to remind you all that COVID-19 is still a thing. People are still getting COVID. It is still a thing. So make sure that you stay at least 6 feet away from any other person when that is possible. Wear your mask as appropriate as follow the guidelines that the CDC recommended. Get vaccinated when you can, if you can. Avoid large crowds if that's possible. Work from home if that's possible. Speak with your loved ones over FaceTime instead of in person. Or if you all are all fully vaccinated, then meet in person. Drop your mask. That's one of the benefits of getting fully vaccinated. Do that. Stay up to date on your local, state, and national guidelines. As you can see, the CDC is constantly updating us on new recommendations. And I'll do my best to come on here and tell you about those. But make sure that you check those yourself, just for general safety and general updates. Again, wash your hand for 20 seconds. That is not changing ever. Keep doing that. We need that. And stay home if you don't feel well. Remember to follow us, Whitman-Walker, on Instagram, Twitter, and Facebook. And then you could also follow us at Real Talk DC _ to stay up to date on all things Whitman-Walker Health. You can also visit our website. I thank you all for tuning in this afternoon, and I will talk to you all later.